Good morning, everyone. My name is Ali Rakoze, and I'm going to talk about social media, especially social media in healthcare, how it's evaluated, like how was the evolution of social media in healthcare. So there are so many advantages while using social media in healthcare, like. Many advantages like some of advantages is like patients can talk, like can have that chat on one with their doctors. uh, at that time the patient is uneasy, and it's easy to communicate with his doctor, and it's the only way, like he is specific, and he really had time to explain what's wrong with him or her, things like that. So also in healthcare, like using a social media in healthcare also can patient can benefit in a way of like let's say that company of health using social media, it can post many services they're giving. Let's say if they have a new service, it will be easy for them to advertise it while using social media, because like social media is used by many people. So like it's a great tool to advertise a new service, or um, like a new practice they are doing there. So that's one of advantage. The other thing is in social media also patient can able to post or give feedback to the facilities, like health facilities, or giving testimony to, so that other patient can learn from experienced patient with different kind of diseases. Another advantage is that many health facilities are under hyper, which is I can say an organization which keep patient privacy, like confidentiality between patient and doctors. So this is another, like this HIPAA tends to punish or to check for patient privacy while in healthcare, like in health facilities. So, how was the evolution of healthcare facilities starting using social media platform? It started by when the digital camera start taking over the place, like the evolution of technology in general. Meanwhile, when like many people start accessing internet by using only their phone, when like smartphone taking over, it's when like social media start take, like the use of uh, social media in healthcare start taking over too. So many people like was able to access information online. That's when uh, healthcare facilities are starting post, like using social media to advocate their product or their services. So this evolution take over when some physicians start making some survey, looking how social media is really taking over in healthcare. So I'm going to give some of the facts uh, of physician that shows how social media is really used in health facilities. So according to Media Bistro, they say that more than 40% of consumers say that information found via social media affects the way they deal with their health. So this means that like 40% of people all over the world like use social media to know or to track their health. So like that's a fact given by media bistro. The second one is that we found that many young people are likely to use social media than older people. So it's 18 to 24-year-olds are more than two times as likely than 45 to 54 years olds to use social media for health related discussions. So this means as youth are likely to interact to use social media more than older people. So another survey showed that 90% of respondents from 80 to 24 years of age say they will trust medical information shared by others on their social media networks. This is what I was saying before, that patient can be giving testimonies via social media so that other people can benefit or can track if they have the same problem. So let's say for example these like chronic diseases, these chronic diseases like HIV. So they have different step, or cancer, they have different steps. So to track it, like you need to have someone maybe who has already suffered that kind of disease so that he can give you some tips how you can manage within the steps of the diseases. There is another fact that shows that 26% of all hospitals in the US participate in social media. This means that they give their services via social media too. Like it's likely because many people use social media or use um, a different application to track their health or to see what's going on with their bodies. Also, some doctors, 60% of doctors say that social media improves the quality of care delivered to patients because, as I said before, a patient is likely open to tell what he feels or she feels within her or his body when he's chatting. Like she's not under pressure, she has time to think what she can or he can write to the doctor. So at that time, the quality of care delivered will be good because the patient get enough time to explain what's happening with his body system to a doctor. So those are some of the key facts, like shows that how social media now has evaluated and how it's used nowadays. So it's really helpful, like it help a lot of people, both patients and uh, health facilities. They benefit from each other. So but that really do its best when we have also this other organization or company that help to make things going well, like hyper. As I said before, it's really limited some doctors to to really track some confidentiality within their patients. So this helper is really help to it's really helpful as a tool to, like as something to track the patient of confidentiality, because some of the doctors may be excited about their work and trying to post what they do to a patient during uh, during the treatment. So thing like hyper really help to manage well the use of social media within healthcare, within healthcare facilities. So that's my video. Like that's a short summary. I was talking about like social media, like evolution of social media in healthcare. So thank you so much for watching this video. See you next time.